The 911 call came at 2:47 a.m. Highway accident, multiple injuries. Paramedics Jake and Susan expected a routine transport, but when they arrived at the scene, what the quiet ambulance driver did left them frozen in shock. He pulled out equipment they'd never seen before and started performing impossible procedures. "Sir, you can't do this," Susan shouted, but Mike Santos looked at her with eyes that had seen much worse. "Watch me," he said quietly, because what happened next would reveal a secret he'd kept hidden for 15 years. Welcome to Hidden Legends. Before we dive into this incredible story, tell me in the comments which city you're watching from today. And if you believe stories like this deserve to be told, hit that subscribe button. Mike Santos was the perfect ambulance driver. At 42, he'd worked for Metro Emergency Medical Services for 3 years. He showed up on time for every shift, never late, never complained. He kept his ambulance spotless, knew the routes perfectly, stayed calm in traffic. The paramedics loved Mike, reliable, quiet, never interfered with their work. Jake Morrison and Susan Chen enjoyed working with him. Jake was 29, had been a paramedic for 5 years. Susan was 31, had worked in emergency medicine for 7 years. Mike was different from other drivers, very quiet, barely spoke. He only provided necessary information. Hospital ready? Traffic heavy? ETA 12 minutes. Short, precise sentences. When they asked, "Mike, where are you from?" he'd say, "Different places." When they asked, "Do you have family?" he'd say, "Not anymore." When they asked, "What did you do before this?" he'd say, "Various things." Jake and Susan were used to Mike's silence, but sometimes they noticed strange things. Mike knew medical terminology very well. Sometimes he'd correct Susan's medication dosages. Sometimes he'd review Jake's procedures. "Mike, do you have medical training?" they'd asked. "A little," Mike had said. Vague, as always. Mike Santos's real story was very different. He'd joined the Army at 18, started in the medical corps, but after basic medicine, he was selected for advanced training. Army Combat Medic, the most elite program. His first deployment was Afghanistan, 2001, when he was 20. He worked in MASH units, saving wounded soldiers. He performed surgery under rocket attacks, saved lives during bombings. His second deployment was Iraq. This time, more dangerous, medical support for special operations units, gunshot wounds, explosive injuries, complex trauma cases. Mike's hands had been perfected in war zones. His third deployment was back to Afghanistan, 2006 at 25. Now he was a field surgeon. Advanced medical procedures, emergency operations, saving lives under impossible conditions. But that day was different. March 15, 2007, a mission in Helmand Province. Intelligence was wrong. They'd been ambushed. An IED exploded. The Humvee caught fire. 3 soldiers were trapped inside. Mike didn't hesitate. He went into the burning vehicle. He pulled out the first soldier. He pulled out the second soldier. When he went back for the third, a second explosion occurred. That third soldier was Danny Rodriguez, 24 years old, newly married. Mike saved him too, but shrapnel pieces had lodged in Mike's left arm. He had limited mobility, but his hands remained steady. Danny survived. Mike's arm was never the same again. "I got injured saving you," Mike would tell himself, "and I'd do it again." He left military service in 2008. At 27, honorable discharge. He wanted to become a civilian doctor. He completed medical school through an accelerated program, became a trauma surgeon. But the real story was just beginning. Everything changed in 2015. Mike was now a successful trauma surgeon. He was married to a beautiful woman named Sarah. They had a 5-year-old daughter named Emma. But that night Mike was on call at the hospital. While Sarah and Emma waited for him at home, a drunk driver took their lives. Mike couldn't save his family. He'd saved hundreds of soldiers in war, but he couldn't save the people he loved most. The trauma affected him deeply. PTSD, depression, alcohol problems. His hands started shaking. He couldn't perform surgery anymore. He lost his medical license. He was fired from the hospital. "I didn't lose anyone in war," he'd tell himself, "but at home, I lost everything." For 6 years, he worked various jobs, trying to get himself together. In 2021, he found work as an ambulance driver. He wanted to stay in the medical field, but not as a doctor. But some things never changed. Mike was still a perfect war doctor. His hands still had surgical precision. His brain could still analyze medical emergencies. Nobody just knew. That Friday night was like any other. Mike, Jake, and Susan were working the night shift. They'd had a few routine calls, elderly fall, chest pain, minor accident, normal night shift work. At 2:30, they were taking a coffee break. Mike sat quietly, as always. Jake and Susan were discussing next week's plans. "Mike, don't you ever take vacations?" Susan asked. "I don't need vacations," Mike said. "Everyone needs them. What do you do in your free time?" Mike hesitated. At home, he looked at photos of Sarah and Emma. He talked to them. He remembered the past, but he couldn't say that. "I read," he said simply. "What do you read?" "Various things." Jake laughed. "Mike, you're a real mystery." If Jake knew the truth, he'd understand how right he was. At 2:47, the call came. The dispatcher's voice was cold and clear. "Unit 23, I-95 highway, mile 47, multi-vehicle accident, 5 cars, multiple injuries, entrapment." Code red. Mike immediately went on alert. This was the reflex not just of an ambulance driver, but of someone who'd performed trauma surgery for years. Jake and Susan checked their equipment. Mike started the ambulance. Sirens on, emergency lights flashing, cutting through traffic. "This looks big," Jake said nervously. "We're ready," Susan replied. Mike said nothing, but he knew. This was very big. When they arrived at I-95, the scene they encountered was horrific. 5 vehicles had collided, a chain reaction accident. An SUV was overturned, engine block completely crushed. The sedan in the middle was unrecognizable. The third vehicle, a pickup truck, had hit the barrier and was lying on its side. Fire crews were using cutting tools to free trapped passengers. Police were directing traffic. Ambulance sirens, radio chatter, the sound of cutting tools. Everywhere was chaos. Jake and Susan froze for a moment at the magnitude of the scene. This could be the biggest accident they'd ever experienced. But Mike? Mike was already moving. "Jake? Susan?" There was no hesitation in his voice. "Let's triage. We'll start with the most critical case." Suddenly, the quiet ambulance driver was gone. In his place was someone commanding, decisive, whose every movement was certain. They ran to the first patient, a middle-aged woman extracted from the SUV, unconscious, blood flowing from her chest. Jake immediately began basic assessment. Pulse weak but present, breathing shallow, penetrating chest wound. "Stop!" Mike's voice was authoritative and sharp. Jake was shocked. Mike had never spoken like this. "What's wrong, Mike?" Mike knelt beside the patient. His hands scanned the patient like an X-ray machine. He performed palpation of the chest wall, listened to breath sounds, examined the injury site. "This isn't a simple chest wound. Look, signs of hemothorax, tracheal deviation, jugular vein distension. This is cardiac tamponade." Jake stared with his mouth open. These terms, this assessment, this wasn't basic paramedic work. "Mike, how do you—" "Jake, this isn't time to talk." Mike's voice came from the MASH unit. "This woman has blood accumulating around her heart. The heart is compressed, can't pump. We have 10 minutes, or she dies." Mike pulled equipment from the ambulance. Normal ambulances didn't carry such equipment, but Mike's ambulance was different. "What are you doing?" Susan asked in panic. "I'm performing pericardiocentesis," Mike said, putting on gloves. "Mike, that's a surgical procedure. We're paramedics, not surgeons." Mike looked at the patient. The woman's lips were turning blue. Her consciousness was fading. "I'm a war surgeon," Mike said quietly. Those words hung in the air. Jake and Susan couldn't believe it. "What did you say?" But Mike wasn't explaining. He pulled a long, thin needle from his bag, prepared the patient's chest. "Susan, prepare manual ventilation. Jake, vital signs monitor. Mike, if you make a mistake." "I won't make a mistake," Mike's voice was determined. "I did this in Afghanistan under rocket attack." The needle advanced from the chest wall toward the heart. Suddenly, dark red blood began flowing from the needle. "Tamponade being drained," Mike said calmly. The woman's blood pressure began to rise. Her color improved. She could breathe. Incredible, Susan whispered. Not a miracle, Mike replied. War training. After stabilizing the first patient, they ran to the second. A young man extracted from the pickup truck, unconscious, multiple trauma. Multiple trauma, Jake said. This is above our level. Mike assessed the patient. Abdominal trauma, signs of internal bleeding, shock, hypotension. There's internal bleeding, could be splenic rupture. This is an emergency surgical case. We need to transport him to the hospital, Susan said. We don't have time, Mike replied. This man could die during transport. Mike pulled a large bag from the back of the ambulance. Jake had never seen this bag before. Mike? What's that? Field surgery kit. When he opened the bag, surgical instruments emerged. Scalpel, hemostats, suture materials, local anesthesia. Jake and Susan were frozen. Mike, are you really a surgeon? I'm a trauma surgeon, Mike replied, putting on gloves. And this man won't die. In the back of the ambulance on the side of the highway, Mike Santos began performing field surgery. Local anesthesia, sterile field preparation, exploratory laparotomy. As his hands moved, Jake and Susan watched, mesmerized. Splenic laceration grade 3, Mike murmured as if he were speaking in an operating room. Splenectomy required. Jake's mouth fell open. Are you removing his spleen? I'm saving his life, Mike replied. After a 25-minute operation, Mike made the final suture. The patient's vital signs were improving. Done, Mike said, removing his gloves. Around them gathered firefighters, police, other paramedics. Everyone was looking at Mike, the man who performed surgery in the back of an ambulance on the side of a highway. Sir, who are you? Mike's answer would change everything. Dr. Michael Santos, trauma surgeon, retired. That night, 2 lives were saved. 2 people lived because the ordinary ambulance driver was actually a trauma surgeon. Jake and Susan were still in shock. Mike, why didn't you ever tell us? Because it wasn't necessary, Mike replied. I'm a driver now. No, Jake shook his head. You're a doctor. I was, Mike said quietly. Not anymore. As the ambulance headed to the hospital, Jake and Susan looked at Mike with different eyes. Who was this man? Where did he come from? What had he experienced? And Mike, finally, was ready to tell his story. Metro General Emergency Room. Dr. Rodriguez, the attending physician, began reviewing the cases. Who provided initial care? Our paramedic team, Jake replied. Dr. Rodriguez looked at the medical records and froze. This is extraordinary. Pericardiocentesis, advanced trauma surgery, complicated splenectomy. This is surgeon-level care. Mike was quietly cleaning equipment, but Dr. Rodriguez's next question would reveal everything. Who provided this level of care? Jake and Susan looked at Mike, and Mike finally decided to tell the truth. I did, doctor. This is residency-level trauma surgery. Where were you trained? Mike took a deep breath. Johns Hopkins Medical School. Trauma surgery specialist. 15 years experience. Silence. And in that moment, everything made sense. You're saying our ambulance driver is a former surgeon. Not just a surgeon, trauma surgeon, emergency specialist. Jake and Susan were realizing, but the real shock hadn't come yet. Dr. Rodriguez's next question would put everything in perspective. Where's your license? Mike's face darkened. I don't have one anymore. Why? After a long silence, Mike answered, Personal problems. I lost my family. I lost myself. I'm not a doctor anymore. In the hospital cafeteria, Mike finally told his story. In 2008, I lost my wife Sarah and daughter Emma. Car accident. While I was working at the hospital, they were coming home. Drunk driver. Jake and Susan listened silently. I was a doctor, but I couldn't save my family. I lost my most important patients. The trauma destroyed me. PTSD, depression, alcohol. I couldn't practice medicine anymore. You lost your license? I gave it up voluntarily, for patient safety. I couldn't trust myself anymore. Susan's eyes filled with tears. But tonight Tonight was different, Mike said. When I saw those patients, I knew I had to save them. I couldn't save Sarah and Emma, but I can save others. Jake leaned forward. Mike, you're an incredible doctor. What we saw tonight? That's in the past, Mike said. I'm just a driver now. No, said Dr. Rodriguez, approaching. He'd heard the conversation. You're still a doctor. Dr. Rodriguez presented Mike with an offer. We have a license restoration program, special training for trauma surgeons. If you want, Mike hesitated. I don't know. I'm not ready. Look at what you did tonight. You saved 2 lives. This wasn't random. This is who you are. Jake and Susan were supportive. Mike, you're the best surgeon we've ever seen, Susan said. You can do this, Jake said. Mike pulled out photos of Sarah and Emma from his wallet. What do you think? He asked the photos. Should I go back? The wind gently moved the photos, as if they were answering. 6 months later, Dr. Michael Santos began working in Metro General's trauma surgery department. He'd regained his license, been recertified. Jake and Susan worked on his team. They'd created a pipeline from ambulance driver to surgeon. Street medicine teaches differently, Mike would say. Every second matters, every decision matters, every patient deserves the best. Mike's story gained national attention. The story of returning from ambulance driver to surgeon. Other doctors were inspired, but Mike's greatest achievement was yet to come. Mike now trains doctors struggling with PTSD. The circle was complete. Your medical skills never disappear, Mike tells them. They just sleep. They wake up at the right moment. The hands that couldn't save Sarah and Emma now train the next generation, teaching precision, instilling confidence, sharing expertise. Jake and Susan are now Mike's closest colleagues. We learned from a legend, they say proudly, because that's what hidden legends do. They don't hide their past. They use it to build better futures. In Mike's office hang 2 photos, the family photo of Sarah and Emma. They are Mike's source of strength, the reason for his inspiration. So I ask you, have you ever known someone like Mike? Healthcare providers whose background you didn't know, where you only saw extraordinary competence? Share your experiences in the comments. Because here at Hidden Legends, we know that the greatest healers often serve in the quietest roles. If this story moved you, share it, subscribe, and to help these important stories continue. We'll see you in the next legend. And until then, remember, your ambulance driver might be a hidden doctor who could save your life. Service never ends, it just changes form.